Hello. So we are going to be going over hip internal rotation today, okay? And if you were with me last week or if you've been on my email list, you know it's something I've been talking about for the last few weeks. Hip internal rotation, I will explain what that is. But it's generally a missing piece in dealing with tight hips or back pain. So a lot of clinicians will tell you need to stretch your piriformis, that your hips are tight, but you stretch and you stretch and you stretch and nothing ever changes. And that's because you don't necessarily need to be stretching them. They're already most likely stretched. What you need to be doing is strengthening them and stretching the internal rotate or the external rotators. And I'll explain this with my pelvis here in a second. So with the pelvis here, okay, so this is if you are facing the front, okay, this is your front, and then this would be your butt. This is your sacrum, and then this is the pelvis. A lot of women that I work with, when they have SI pain, it's on the sides here. Okay, this is called your sacrum, your iliac. Okay, so sacroiliac joint, SI joint. It's right in here. Okay, now in a lot of reasons, women get pain there, and then people tell them, oh, you just need to stretch without really diving into the mechanics of what's wrong or why are you feeling tense? Why is there tension back there? Because 9 times out of 10, you don't need to stretch. What you need to do is figure out where is the kink in your chain, okay? Where are you overworking? Where are you underworking? And then that's usually why you're getting that pain. So that's why we talked about well, not last week because last week did not work. The week before, talking about breathing and those basics to make sure that we can get a full 360-degree inhale, making sure that diaphragm and the pelvic floor can kind of come up and down together, that your pelvic floor can relax. Because if you can't get your pelvic floor to relax, you're always going to have some kind of issues, whether that means you have a flat butt, you look like you have that mom pooch, you have pelvic floor issues. You can't fit into bras anymore because your ribs are stuck. You know, there's so many things that go wrong if you don't establish that breathing pattern. Um, and then the next layer to that, once you can stabilize kind of the top of the pelvis, then we need to establish, how do we move around the pelvis and the femur, your long bone, where it sits right here, how does that move and glide? Because can it rotate? Can it not rotate? Okay. And for some reason, Jan keeps pushing me away. Sorry. So with that being said, okay, we now have the pelvis. Okay. So looking again, front view, or let's do top down. So then like if I'm standing up, head down. This is super important in birth too. And so I know I deal with postpartum, but if you are pregnant or you know somebody who is pregnant, that you want to explain this to them. This is why we don't necessarily want us birthing on our backs and somebody holding our legs out to the side. Because what that does, baby has to drop through here and then come out here. When we do what normal medical people want us to do, that will close the space. Okay. And that's when you go into what's considered pelvic external rotation. Okay. For the outlet. Okay. So this is the outlet, this is the inlet. So now you have your inlet external rotation. Okay. That closes down the outlet, as you can see, and harder for baby to come out. So that's why they generally don't want you birthing on your back, because it closes that space and it makes it harder on the pelvic floor. Now, remember, your pelvic floor is not what pushes baby out. Your uterus pushes baby out, but your pelvic floor muscles have to learn to relax and lengthen, or you could potentially tear and have issues. Okay. So pelvic external rotation is when it goes out. All right. Now from the back side, this can also happen if you are a glute clencher. So if you are somebody that squeezes your butt all the time because you don't have the ab support, what happens is then this gets smushed. Okay, so I don't know if you can see it from the side, but it kind of gets smushed down and you can get that tailbone pain, that like deep butt pain that nobody likes, as well as this kind of will flare again because those glutes are pulling you down. Okay, so you can see when you don't have, sorry, when you don't have good core control, where all those compensations happen, and then end up being like this, okay, or flaring. So why do I explain all this? because the glutes, the glute max especially, it is the key hip extender, meaning it pushes us forward. So when you are running or walking, that should be the last thing to kind of push you forward. That's when you bottom your squat, you come up, you want to be using those glutes to get you up. Now, what people forget though, or maybe not a lot of women know, is that your glute max is also an external rotator. So it rotates out. So if you ever notice when you're doing your squats or your hip thrusts or any kind of movement like that, if you roll your foot to the side, that's again an indication that you are compensating for something at the glutes. The glutes aren't able to be as efficient as they want to be. If you walk with your foot out, that's considered external rotation. Again, you have some limitations that you need to address, and usually it's because you're glute clenching. Now, that's not the only reason why, it's just one of the reasons why, okay? And I explain all this, so hopefully you can understand. We tend to be in an externally rotated position postpartum just because of how we carry baby when we're pregnant. And then if you go from pregnancy to birth and then you just lay around for 6 weeks and then you go back to your normal program, you might not have established or re-established proper mechanics, okay? So that's bringing all of that to say that is why hip internal rotation is super important, and why when you reestablish it, a lot of your hip pain and tightness can go away, okay? So the hip internal rotator, okay, because here's our femur, the long bone, okay, a lot of them are going to be attaching to the sacrum too, okay? You have muscles that kind of come from the top and they blend and they come down into the femur, and then they kind of help rotate it, okay? And then when we get that internal rotation, what that allows for is as my legs kind of turn in, that naturally is going to open up the backside. So especially if you are a glute clencher and you're somebody that holds a lot of tension back there, or if you are somebody that you have that really deep butt pain and you're like, man, like no matter what I do, you constantly want to stretch your piriformis because that's what somebody told you to do, and you just feel like I gotta stretch, I gotta stretch, I gotta stretch, then this is going to be great for you because I'm going to help you figure out what exactly to do to stretch. Before we go over those, I'm going to show you just a couple of tests that you can do on your own to see, do I lack internal rotation? Okay. Now some of them would be better if you had somebody like me that's assessing you, because I know what I'm looking for. But these are just a couple that we're going to walk through together, and then hopefully they will make sense to you. So bring them to the floor here. First one. Okay. So I'm on my back here. All right. I'm going to go ahead and I'm going to bring my foot up like this. Oh my gosh, Jan's about to take over. Sorry, guys. Okay, so I'm going to be here. And then can I rotate my ankle out to the side? So, you see me here? Okay, so I'm going to foot up. And I go out to the side. And I come in. So even though my foot is in, going into external rotation, this is going to be internal. You might feel I have limited internal rotation, so you can feel like a tension in the front. Okay, and the next one, we go out. I have a little bit more on that side, not so much there. Okay, so there's I don't know if we're still recording. Okay, sorry, Jan is typing everything. Okay, the next one you can do on your stomach, and this can be a little bit more challenging. So I'm going to try and hold my computer for you like that. So the same thing, you can bring your foot in and then, sorry, you can let your foot kind of fall out to the side. You can tell I don't really go anywhere. I can feel that there's like a bony, something stopping me, and then you can roll it in. Now from the side, hopefully Jan doesn't grab my computer. You can also check for, okay, when I go side to side, see how I kind of rotate? Now I'm exaggerating it for this video, but that's another thing you want to check for too, is what's happening up here? Do I have control up here to move my femur around? Going this way, you can really tell that like my whole body wants to go. All right, if I do the other side, sorry guys, you're going on a wild ride with me. This is my bad side. Okay, this way you can kind of see my glute starting to pop up, and then it's kind of struggling to go to the side there. Okay, so I am somebody that again struggles with a lot of hip internal rotation or lack thereof. Sorry, y'all, we are going on a ride today. Okay, so those are just two super quick and dirty ways that you can assess hip internal rotation. Now, again, there are other ways that if I were treating you or if you were a client of mine, I would run you through a bunch of other tests, ask you a bunch of questions like, how does it feel? Where do you feel it? Those kinds of things, because that leads me into figuring out, okay, like, why are you lacking internal rotation? Because you're not born with that. It's usually there's some muscle pulling or not pulling or that's weak. Those are the things like we were talking about. Okay. So now you're probably thinking, okay, Kara, I just feel tight. What should I do? Great question. So the number one thing I always recommend to people is called a rock back. And after I post this live, I will put links to the YouTube videos in the comment section. So that way you can just click the video and kind of go from there if you don't want to listen to everything that I said, which is totally fine. So the rock back, I gotta grab something. Okay. I forgot my yoga block in the midst of doing all this. So we're gonna use a water bottle. Okay. So what you're gonna do is you're gonna go ahead and put this in between your knees, okay? And then you're just gonna go ahead and squeeze that. So that squeeze is gonna get those adductors involved. And another way to help with your internal rotation is strengthening your hamstrings and strengthening your adductors. Okay, so if you're somebody that feels like you constantly have tension in your hamstrings or your adductors, then you have a compensation somewhere. Okay, you need to figure out what's going on to allow for that hamstring to relax, those inner thighs to relax. Okay, so you're gonna take a water bottle or something, put it in between your knees. Okay, and then you're gonna kind of squeeze to get those inner thighs. And then from here, we're just gonna rotate our foot out to the side. So on this side, we're going out to the side. Okay, back and forth, just like that. What you want to do when you're in that position, oops, sorry, girl, is again, you are always exhaling. Okay, so we should feel our abdominals, make sure we can get that pelvic floor lifted, keep our back flat, keep our glutes squishy, and then you're just moving your foot out to the side. Okay, and then from there, she has my block. So pretend that I'm squeezing something. Okay, and then from there, I'm gonna go out to the side, and then as I inhale, I'm gonna rock back, keeping everything nice and engaged. Okay, so I'm here, I rock back, stay nice and tight in the middle, and then I hang out here for a minute or two, and then I can come back up. Okay, you really want to be mindful that you don't change that pelvic orientation too much. Okay, because when you tuck under too much, or if you start to sag, again, then we've shifted that pelvis and we're not going to get the same stretch that we want. Okay. So that is probably the number one easiest way for somebody to figure out how to lengthen those hip internal rotators without necessarily doing that pigeon stretch or whatnot. And then from there, sorry, you can work into strengthening the hip or internal rotators. And then again, as those strengthen, then those external rotators, aka that glute max, should relax and that back pain should go away. Okay. Now, again, this is a very quick and dirty example and rundown of the hip internal rotators. And so if you want more help or if, like assessments on something, how to check yourself would be helpful, let me know and I'd gladly go over those. But most of those assessments aren't going to make sense to you unless you have a trained professional like myself running them with you, because you're not going to know what you're looking for and you're not going to understand what the findings are. Like, okay, so you're tight, but what does that mean? Okay, because there are so many layers. No back pain is the same. No postpartum is going to be the same. You might have had multiple babies and you can even agree to that. Like, oh yeah, like, postpartum 1 was different than postpartum 2. Things like that. And so that's why it's really important that if you are struggling and you've been trying things on your own and they're not working, that, sorry, to get professional help, because they can make things happen faster and you can get out of pain sooner and start feeling your best. So, if you want more information on hip internal rotation, like I said, I will link a couple of things in the comments once I post this. But I'm going to go ahead and cut this short just because you can see now she is starting to pull my hair. But go ahead and give that internal rotation rock back a try. And then try those active range of motion hip internal rotations. See, how does it feel? Does it feel the same side to side? Do you feel like you have the same motion side to side? Do you feel like a good lengthening and a good opening when you rock back? Let me know what you feel in the comments, and then we can kind of diagnose and treat from there. So hopefully this was helpful, and I will see you guys in my next live next week.